Hello, thank you for joining us for today for our Summer Safety Tips presentation. My name is Gina Ora. I'm the Physician Liaison at McLaren Bay Region. And during today's broadcast, as questions come up, please feel free at McLaren Bay Region. Welcome, Patricia.
Hi, Gina. Thanks for having me. Thanks, everybody, for joining us. I wanted to talk with everybody about Trauma Awareness Month and certain things that we can do to prevent injuries from happening as our summer months are here and warm weather injuries are happening. All right, so here we go. So a little bit about Trauma Awareness Month. It was established in 1988 by Ronald Reagan. He recognized the need to address trauma care, education, and injury prevention throughout the United States. Up until that time, there were a lot of injuries, severely injured patients, and deaths due to trauma. So we started taking this time to focus on preventing those from happening. So every year since that time, the Society of Trauma Nurses and the American Trauma Society places attention on different aspects of trauma care, and we celebrate Trauma Awareness Month every year. Over the previous year, there's been a lot of drastic increases in intentional violence throughout the United States. So this year, we are focusing on safe surroundings for the 2022 Trauma Awareness Month. So a little bit about McLaren Bay Region, our trauma services. Again, we're dedicating to highlight all the areas of trauma care and just remembering that trauma does not only address what happens in the emergency department, but it's really from what happens when the injury occurs all the way through their stay through the rehab. And we do a lot of efforts to make sure that we try to prevent any injuries from happening with our community outreach and injury prevention programs. So as we are a designated trauma center, from July of 2019, we do see between 850 to 900 trauma patients per year at our hospital. With our designation, we do have several specialty trained physicians and nurses related to trauma care in the emergency department and throughout the hospital. And really our ultimate goal is to make sure that if you come in and you're injured, that we see you and evaluate you and provide the best care to get your injuries taken care of. So what exactly is trauma? We talk about it, and it's an energy force applied to the body. So really anything that impacts the body or hits the body from outside. So the greater the energy or the higher the speed, the worse the injury is. And when we talk about trauma, it's not always the high force, dramatic, intense situations like motor vehicle crashes. Really, falls are the number one reasons why trauma patients come to the emergency department. And it's simple as a fall from standing or off of a roof, a ladder, from a tree stand, when we start talking about hunting injuries in the fall. So really, trauma occurs in day-to-day life, and especially with our aging population, it definitely continues to be more complex as we look at comorbidities of our patients. So as we talk about preventing injuries and the warm weather being here, we do see certain trends with summertime and warm weather injuries. So looking at our burns, potential drownings or water injuries, as well as head injuries when we start thinking about biking or skateboarding, rollerblading around our town. So when we look at our seasonal injuries, we want to make sure everybody stays safe with fires and bonfires, grill safety and things along that lines. So when you do have a backyard fire pit, or if you have a bonfire, campfire, make sure that you're trying to stay at least 3 feet away from the fire, as well as making sure the fire is nowhere near anything that can catch on fire, such as a fence or a home or even a playhouse. So really make sure there's a nice space, a wide open area. Also, if you do have one of the backyard fire pits, they come with metal screens. It's very important to make sure that you are using that metal screen and put it over the burning fire, basically to make sure that there's no sparks that float out and can catch other things on fire. And very important that we are making sure that we pay attention to the fire. And if you leave the backyard and are done with the fire for the evening, making sure you put it out with water and that the fire is completely out as well. Other burn or fire injuries that we see are related to grilling. So again, when we talk about our 3 feet, make sure the grill is 3 feet away from the home or 3 feet away from things that could catch on fire, even such as a deck. And always make sure you pay attention to the grill and never leave it unattended. And one important thing also is to make sure that we are cleaning off the grill when there is grease that's left on it and you go to start it again for the next meal. It could catch on fire as well. So just something to keep in mind to be very safe with that too. Other injuries that we see, and we're in the Bay City area, there is water everywhere. So we have beaches and pools and also a lot of boating incidents that can happen in our area. So just very important that if you're at the beach, make sure that you stay in an area that is designated for swimming, supervised by lifeguards. And it's always good to take a buddy with you to make sure that you have somebody that knows where you are and you are able to know where they are as well. And when we talk about boating accidents, not only is it very important to make sure that you have a life jacket on and you're staying safe with a life jacket, but never operate a boat while you're under the influence of drugs or alcohol. That could really impair your ability to maneuver the boat and cause potential injuries as well. A few more things when we talk about the safety of pools. It's always very, very good and recommended to have a barrier or a gate around the pool so that way nobody can access it when you're not around to be able to supervise that. And very important when we talk about young kids to keep pool toys or any toys out of sight when you're not in the pool. It draws the children to the pool and it can cause some unfortunate events when we talk about that. And also when you do have young children in the pool, it's very good to make sure that we stay and pay close attention to the little ones in the pool and also make sure we're putting down our phones. Drowning is not a loud injury per se, so you need to make sure you have your eyes on the pool attendants at all times. Also, when we look at warm weather injury, we look for bike safety. So it's very important to make sure you're checking your equipment, making sure that the brakes are working properly, that the tires are pumped up to where they should be, that the seat is not wiggly. And make sure when you're riding down the roads that you plan to be seen. So wearing bright colors, neon colors, things along that line so you are able to be seen by drivers. Also, wearing a helmet is very important. As you can see, we have a little bit of information on how to make sure a helmet fits correctly. But the overall guideline is to make sure that it fits snug on your head. And that is actually the primary thing that you can do to prevent any further injuries when you're riding a bike or skateboard or rollerblading down the road. When we talk about following the rules of the road, it's just making sure that when we're in a group, you stay in a single file line, making sure we're following all the traffic rules and staying alert. Again, staying alert, be safe, and be aware of your surroundings because you never know. So not only do we have summertime injuries, but we also have injuries that we happen year-round. So ground level falls, again, we see very, very often in the emergency department. And there's a few steps you can take to help prevent those from happening. So making sure that we are open with talking to our healthcare providers about fall risks or potential for falls. Other things that you can do are making sure that you're exercising to improve your balance and strength. Having your eyes and your feet checked. So when we talk about that, it's just making sure that you're able to see your surroundings and see where you're going. And with your feet, it's making sure that they're properly cared for. When we start talking about diabetes and neuropathies, patients aren't able to walk or feel as they normally would. So if there's unstable ground, it gives a high potential for somebody to fall. And several things you can do around your home, very simple, cost-effective ways to make your home safer, and that's really removing your trip hazards. So when we talk about things like that, it's basically removing rugs, clutter in the walkways. If there's any extension cords that are going across the floor, just make sure that those ways are cleared. And also another inexpensive way is I call it lighting the way, but just making sure at night you have night lights plugged in. So if you do have to get up and go to the bathroom or check on something, you can see where you're at and see where your surroundings are. And it really does prove to be effective when preventing falls. Other year-round crashes that we have are motor vehicle crashes. So just a quick heads up, make sure that when you drive, you are focusing on the road and not be distracted when you are. So things as simple as eating and drinking can distract you from driving, adjusting the navigation system, stereo, any type of entertainment packages that are within your vehicle, and for sure, phone use. It's very important, again, that we just stay focused on the road. There will be a link in the comments section for just a quick PSA from the National Highway Traffic Safety Administration that just kind of hits home just a little bit. So please make sure to check that out. All right, and I just want to thank you everybody for the listening, and if anybody has any questions.
Thank you so much, Patricia. This is a great topic that you're covering, and you've provided some very important information that I know our viewers will definitely get some use out of. And we'd like to go to, we do have a question. We do want to make sure that you do know we have the link on our comment section for that video, and it's definitely worth watching. So our first question today is from Emma, and her question is, what should you have on hand in a first aid kit?
All right, Emma, that's a great question. There's a lot of simple things that you can put in a first aid kit that are really going to be helpful. So things like bandages, gauze, Band-Aids, making sure hydrocortisone ointment, as well as triple antibiotic cream. Tweezers are also good, as well as like an ice pack or like a cold pack that you can apply for any type of sprains or strains as well. So just some quick and easy things that you can kind of put together.
Okay, great. We have another question from Elena, and hers is there anything you can do to help prevent ground level falls, especially for elderly parents and grandparents?
Yes, there's a lot of different steps that you can take. So it's actually very important that you're open with your healthcare provider regarding any type of falls that you may have had. It could be some simple adjustments with medications or getting an assistive device as a cane that could help. We did talk about making sure that paths are clear and rugs are removed from the floor. We see quite a bit of patients that have fallen because they have tripped over a rug, or also even just uneven ground. And just it all boils down to making sure you're aware of where you're at and what your surroundings are.
Okay, another great question from Elena, and her question is, what should I do if I burn myself on the grill?
So it's a very good question. It really depends on the type of burn and where you've burned yourself at. So if we talk about different levels of burn, first degree would be like a sunburn. So it's very important that you just you apply like cold water to that. If it's a worsening burn where your skin is gone or it's starting to bubble, if it's on your hands, you do really want to seek help for that. If it's a large portion of your hands, because it could require more intensive therapy and help and care. So if we do talk about burns, just making sure that you put it under cold water and stop the burn as quickly as you can. And just one thing to remember also, putting ointments, or I've heard old wives' tales of butter on burns don't help. They hold the heat in. And ice, if you put it on a burn, it can actually cause frostbite and damage the tissue worse. So just making sure, again, under cool water will help quite a bit.
Okay, well, you answered a couple of my questions as well. I always thought ice was the way to go, but apparently not. So great. Well, we can't thank you enough for sharing your time and knowledge with us today, Patti. And I just would like to take a moment to share a great upcoming program with you that Patti is offering for the community, Stop the Bleed Blitz, which will be held on Thursday, May 19th at McLaren Bay Region. She will be offering 4 30-minute sessions that day. For all the details, check out at www.mclaren.org/Bay Region and search for Stop the Bleed Blitz. Thanks again so much and have a safe summer.